Hey guys, so over the next few weeks we're going to be releasing a whole bunch of really cool interviews that we've taken with some incredible people that are doing very cool things in the world. It's called Bigger Than Me Change Makers. Our first interview now, which I want to share with you, is with an amazing lady called Lauren Bright. She's the country manager for Operation Smile. We have a long history with Operation Smile, but they're doing such important work on the African continent and giving the power of smiles to young children and people with cleft lip and cleft palate. So without further ado, here's our chat with Lauren Bright. Hi Lauren, how are you doing?
Hey Greg, I'm good, thanks. How are you?
Good. I'm good. Surviving, getting through whatever's happening in the world at the moment. So it's definitely been an interesting time.
It sure has.
Yeah. Cool. So I really appreciate your coming on for our first sort of episode of the Bigger Than Me Change Makers series. Um, and I really just obviously we've got a relationship in terms of Bigger Than Me and OpSmile, having worked with you for a long time. Um, and kind of the idea that I had was just sort of really want you guys have obviously been doing incredible work for a long time, um, from an international organization point of view, but also more particular from your point of view in terms of being the country manager for OpSmile, um, and what you're doing in Africa at the moment. So maybe just tell us a little bit about what you guys are doing, and yeah, let's take it from there.
Yeah. Well, Greg, firstly, thanks for having us and, for being part of an incredible part of our journey. UpSmile South Africa is part of a global nonprofit medical organization that provides free cleft lip and palate reconstructive surgeries to specifically vulnerable children and adults. For those of the listeners who aren't aware, the cleft lip and cleft palate is a condition where a gap in the mouth doesn't close during the early stages of pregnancy, and it's one of the third most common birth defects worldwide. So every 3 minutes, a child is born with a cleft globally. And, these stats don't change during a global pandemic. So in terms of South Africa, and where we've been in terms of, global, we've, since 2006, OpSmile South Africa has executed medical programs in 7 cities across South Africa. We're one of the world's largest volunteer-led organizations. So we're very blessed in South Africa to have over 120 active, engaged medical volunteers who really add value on missions. We're all about building up local capacity, training skill locally, and our volunteers have been a big part of that. Um, Healthcare workers, we do training in basic life support, pediatric advanced life support, and also helping babies survive. So we've trained over 1,300 healthcare workers. So we're really there to try and fill in, any gaps that we see in the health system. We know that there is a major need around the world in terms of these kind of congenital anomalies, and we really are trying to move the needle in that regard. So, we really believe that safe surgery, safe, effective, timely surgery is a human right. And for a lot of these patients who live in deep rural areas, it's really difficult for them to get that safe surgical care.
Yeah, I mean, that's been in my experience with working with OpSmile for a long time, is that, and having attended some of the missions that you guys have been, that
Yeah.
you've had, to actually see the difference of someone barely being able to recognize their own smile, or smile that they've never had before, their own expression, just because of that life-changing surgery. I mean, it's an absolutely incredible experience. I mean, you're
Yeah.
absolutely right. It's a basic human right,
Yeah.
and it literally changes people's lives. Like that instant, it changes um, their their how they'll be accepted in society, in their rural communities. I know a lot of a lot of young children and mothers in particular have been ostracized from their communities. So it's vitally important, the work that you guys have been doing. So with that in mind, not being able to do exactly what you've been able to do from an organizational point of view in terms of running missions or training healthcare workers and that kind of thing, how have you guys had to adapt over this period, over the last 3 or 4 months with the pandemic?
Well, I think I'm going to start off with using the famous COVID word, which is pivot,
Yeah.
which we've all had to do. But obviously, we had to stay relevant. We had to go to where the immediate need was for the communities and patients that we looked after. So, in terms of COVID relief efforts, we really got involved there on the PPE side, on the food side, on the malnutrition side. Just to give you a little bit of stats, we supported in around 6,200 meals and food parcels being sponsored. We helped with donations of blankets, nappies, menstrual kits to about 160 people. In terms of PPE, over R1 million worth of PPE donated to our hospital partners and communities. And then nutritional support. We partnered with a phenomenal NPO called Grow Great, and we donated, towards specifically pregnant women who are particularly vulnerable. We donated towards nutritious packages for them, because obviously we know that malnutrition in utero can be attributed to the prevalence of infants born with cleft lip or palate conditions. So, assisting expecting mothers was of paramount importance to us. Grow Great is a wonderful NPO that aims to galvanize South Africa towards a national commitment to zero stunting by the year 2030. Quite frankly, the key word, other than pivot, has been collaborate. Supporting NPOs, inter-referring, linking up. We've done another collab with Pick and Pay, a charity clothing collection drive. DHL came on board to support us in getting the packages out, but we've linked up with SS Children's Villages and Rays of Hope and ourselves to help support our beneficiaries. One of the other partnerships, we've also been helping Jabulani, which is another NPO that runs the Zitulele Hospital in rural Eastern Cape. The levels of malnutrition are obviously pretty high there. They service 120,000 people in that area. So, with COVID-19, it's really, affected these households and increased, the hunger and the need there. So, we help there with a hospital-based support program, and we want to keep investing and we want to keep building these partnerships, because I really believe, Greg, in line with what this whole talk is about, that the only way that NPOs are going to survive the next few months or even the next few years is through collaborations and partnerships. That age-old addendum of there's one pie and we all need to clamour for the same pie. That doesn't exist anymore. When I get asked often, if I go to a donor and they say, well, we don't support medical charities, I say, well, what do you support? And if they say, well, education, then I give them a suggestion of Rays of Hope in Alexandria, who are doing phenomenal work. So what I think our job is as NPOs is to get to know the other NPOs that exist in our communities, that are helping move the needle. Get to know them so that when you're pitching to a donor, you can refer another NPO. You can, have meetings. Let's extend our network. Let's not be greedy or selfish in our approach, but let's think of the bigger vision. Let's share our vision for the future of South Africa. Let's share our goals and our dreams, and let's align and let's support one another.
Yeah, I think that's been one of the things that I've seen or been really encouraged about, through this time, is that the amount of collaboration that's actually taken place between different organizations, and partnerships and how they've supported each other. And one of the key elements that I've seen is how vulnerable young children are. during that have been during this time. Whether it's been from a nutrition point of view, or whether it's been not being able to go to early childhood development centres, or and particularly the really young children, where some of the meals that they receive are the only meals of the day if they attend the early childhood development centres, and with them not being able to go to these centres, they're not getting fed. And their parents having to try and still go to work, and so they've been left at home with no sort of adult supervision or anything like that. So it's just been a crazy time where the most vulnerable of the vulnerable have been left exposed, during this, and that's what's been so amazing with a lot of these organizations, is that they've pulled together, whether it's been through education or nutrition or whatever it might be, to try and sort of plug the hole, or this massive gap that's actually just increasing now. I mean, if it was bad before COVID, it's just opened up even more now. So and kind of with that in mind, I mean, how are you seeing? You mentioned something interesting. Where you're chatting to a particular donor, and if they say they don't necessarily do exactly what you guys might be pitching for, but you're able to maybe recommend someone else. Like, how do you see sort of giving and that kind of thing evolving over the future now, in terms of obviously donors are going to be under far more pressure at the moment. The charity model has always been questioned for a long time anyway. So a lot of that international funding is going to be reallocated into different places now. And I think there's, correct me if I'm wrong, but I think there's over 200,000 NPOs or NGOs in the country at the moment. So that pie is definitely shrinking. Hey? So how do you sort of see that changing over the next sort of into the future, in terms of evolving from a model?
Yeah, I mean, currently, NPOs act in communities where government and businesses are unable to reach. So they are accessible, act with urgency, to meet immediate needs in times of crisis, which has become very evident, of course. But the estimated 230,000 registered not-for-profits in South Africa obviously provide, like you said, a wide range of services to these marginalized communities, and they employ in total about 800,000 people. So, if you look at cutbacks in donations and cutbacks in other sources of income, this is a sector that is at risk currently. However, what has actually been quite interesting about what COVID has done is, it's during lockdown, I think people really had this moment of finding their purpose and having time being locked down, kind of going, why are we all here? So there are actually more people donating in an individual capacity, I believe, than ever before. So being able to contribute and have a purpose is more important to people now than it's ever been. So people are reassessing their life mission and their life vision. So the virus has also highlighted the frailty of life and how crucial it is to be of service. People have done this deep introspection about how they've lived their lives before COVID. So, just in terms of, and the reason I'm bringing that up is because that is what I believe is going to save the industry. Because if you look at some stats, which I'm going to share with you, 91% of global consumers expect companies to do more than make a profit. They now expect companies to be doing good and to be involved in CSI. Employee retention, 74% of employees say that their job is more fulfilling when they are provided with opportunities to make positive impacts on society. Millennial engagement, 76% of millennials consider a company's social and environmental commitments when deciding where to work. So, Greg, what we're looking at here is a shift in the human spirit. This is what COVID-19 has done. So this is where I believe the strength, the role of NPOs has been highlighted. and the work that NPOs do to keep societies alive and surviving has also been highlighted. So things like employee motivation, stakeholder relationships, community acceptance, market strategy, brand strengthening. I mean, these are all things that exist within NPOs because ultimately they're here to transform society. They can step in fast, quickly, they can meet the immediate need. So I really think, and I want to give a positive spin to this talk because I really believe that with this kind of conscious collective and this change that has happened, that people are more giving now than ever before.
Yeah. Yeah, I mean, I completely agree with you. I think the shift has been coming for a long time, in terms of how things have been done for a long time, and that system's been broken,
Yes.
where the very limited few have benefited from it for far too long,
Yeah.
and I think this is. We're kind of on this precipice at the moment where we have the opportunity to really bring everyone with,
Yeah.
and there's the potential where that precipice could just get bigger in terms of
Yeah.
people getting left behind,
Yes.
But I mean, I think exactly what you've said, like MPOs provide that service where government can't get involved or don't have the resources to get involved or can't get involved that quickly because of bureaucracy or whatever it might be, red tape. And then corporates, if they're selling a can of beans, that's what they do. They sell a can of beans, and they might be able to support through providing those, financial support or whatever it is, but they can't get on the ground as quickly as the MPOs do, But I think there's it's vitally important now, and I think from a brand communication and brand strategy point of view, like a purpose-led strategy is something that we're calling like purpose-led humanism, really.
Oh,
Because
love that.
the strategy
Yeah.
around that is basically just, you start with what is right from a human point of view. It's really that
Yeah.
simple. What is right? What do we do as a company? What are the products we making? Is it going to mess up the world? Is it going to mess with the environment, or is it going to impact negatively on a particular community, whatever it is? And then that's where you start. And then from there, you can create your different products
Exactly.
and strategies and business strategies. And, it doesn't, there was this talk of it sort of very much being woke washing or like greenwashing used to be or whatever it is. But it's not that at all. It's about you can still make a profit, you can still have a great company and still satisfy shareholders, etc., but not at the cost of the environment or the cost of marginalized communities and that kind of thing. So I think big business has a vital role to play as well in terms of supporting initiatives and social issues and that kind of thing that are going to uplift communities and provide opportunities, but at the same time make money, and you're right. Like, we've seen it from an organization that employees that are young employees that are coming into organizations, they want to know what those companies are doing from a
Exactly.
socially conscious point of view, and that's really a good thing,
Yeah.
that's and I think it's something that's hugely positive.
Mm. What's interesting is the word philanthropy means the gift of human kindness.
Yeah.
And kindness is really a theme for 2020 because I think we all thought we were kind pre-COVID, but it's just shown how more of it is required.
Yeah.
The other thing is the spirit of volunteerism that has emerged, and the amount of people who got involved in volunteerism. So I think, like I say, it's spreading a positive edge to this. We've realized that the beautiful domino and ripple effect of positive change has really been for me what has shone during this time, and how in the hashtag stronger together, we can't achieve anything alone. We can in community, and we can in partnership, and we can collaborate for impact. And I think, if I could give one messages to brands out there, um, get more involved, get your employees involved. They want to be, give them opportunities to engage with CSI organized, and NPOs. We look at some of our case studies of, just donors being blown away at being involved and having the experience of making a difference, and seeing that tangible result, and seeing the gift of a new smile, of someone's uplifted. And I really believe that South Africa has some of the most incredible NPOs. You're really doing the most phenomenal work.
Yeah. I mean, I couldn't agree with you more, man. So Lauren, thank you so much for your time.
Yes,
I really
thank you
appreciate
so
it.
much.
I know how very busy you are, changing the world and creating smiles for people. So I just wanted to say thank you very much. I really appreciate the time, and all the very best with everything that you guys are doing.
Awesome. Thank you so much, Greg. Best of luck to you as well.
Cool. Thank you.
Okay.
Cheers. Bye.
Okay, bye.